All right, we're going to take a journey through the Italian healthcare system, and we're going to follow the arc of a human life from the very beginning to the very end, all guided by the latest data and developments. So, here's our roadmap. We're going to cover 5 key stages. We'll start with how science is changing the way life begins. Then we'll look at the quality of care across the country. After that, we'll dive into the secrets of Italy's famous longevity, explore the surprising role of beauty in healing, and finally, we'll tackle the really complex debate around life's final chapter. So, let's start right at the beginning. For a growing number of families in Italy, the story is starting with a little help from science. Check out this number, 15,085. That's how many babies were born in Italy in 2023 thanks to medically assisted procreation, or AP. Now, this isn't just a big number, it is the highest figure ever recorded in the country. It really signals a major shift in how families are being formed. And this growth is just staggering. I mean, look at this. The number of births from MAP has almost doubled in just a single decade. A big reason for this is that these procedures were recently included in Italy's essential levels of care, which makes them way more accessible. And honestly, this trend is almost certainly going to keep climbing. But this isn't just about numbers. It's also about some pretty amazing technological progress. Just a decade ago, it was common practice to implant multiple embryos, which led to a twin birth rate of over 20%. But fast forward to today, and thanks to incredible advances in single embryo transfers, that rate has been slashed to under 7%. That makes the whole process so much safer for both moms and babies. Okay, so a child is born. What kind of healthcare system are they entering? Well, the data paints a really interesting picture, a system that has both world-class strengths and, at the same time, some really deep divides. It's kind of a tale of two Italys. Yeah, when you look at the official rankings from the Ministry of Health, you see this massive north-south divide. It's pretty stark. You've got top performers up north, like Veneto, scoring almost 290 out of 300 points. Meanwhile, regions in the south, like Calabria and Sicily, are lagging way behind, with scores that are nearly half that. But, that's not the whole story. That regional disparity doesn't capture the full picture. If you zoom out to the national level, Italy actually excels in some really key areas. For example, take access to new breast cancer drugs. Italy has one of the highest reimbursement rates in Europe. A full 78% of new therapies are covered for patients. And this really highlights that key paradox we're talking about. On one hand, you have these big regional gaps, but on the other hand, the national system can be incredibly efficient. Approving new cancer drugs takes just 417 days on average, way faster than the European average of 559 days. That means getting cutting-edge care to patients who need it sooner. All right, let's jump to the other end of the lifespan now and look at something Italy is famous for: longevity. So, how do Italians live so long? It's a question researchers have been puzzling over for decades. And it turns out, part of the answer actually started right there in Italy, with this concept called the blue zone. The story goes, researchers literally took a blue pen and drew a circle on a map, right over these specific mountain villages in Sardinia that had this crazy high concentration of men living to be 100 years old. But, and this is a big but, modern research, including from the very demographer who coined the term, warns us that the Sardinian secret isn't some simple lifestyle you can just copy. It's a very specific, very localized thing, tied to a unique mix of genetics, geographic isolation, and social history. Still, even if you zoom out from just Sardinia, the entire country has one of the highest life expectancies in the world, second only to Spain in all of Europe. And get this, as of 2024, there are over 22,000 people aged 100 or older living in Italy. Okay, so it's not just about adding years to life, it's about adding life to those years. And there's this really fascinating movement in Italy to improve the quality of life for patients using, well, art. The basic idea is that beauty itself can be a kind of therapy. There's actual neurological research showing that looking at a piece of art can light up the same parts of your brain as seeing someone you love. How cool is that? It can measurably reduce a patient's anxiety. It's all about humanizing these cold, sterile hospital environments to make medical treatments even more effective. And this isn't just a theory. There's a new project in Rome called Art and Health that's putting this into practice. They're doing things like installing digital paintings in oncology units, organizing art exhibits right there inside hospitals, and even arranging guided museum tours for patients and their families. They're bringing Italy's incredible cultural heritage directly to the people who need it most. And that brings us to our final stop, and it's probably the most complex and sensitive part of our journey: how Italian society is navigating the very end of life. So here's the situation. Assisted suicide is technically legal in Italy, thanks to a big court ruling back in 2019. But the national parliament has never actually passed a law to regulate it. And that's created this kind of legal vacuum where there's no clear, consistent process for how a person can actually access it. So, into this vacuum, the region of Tuscany has decided to step up. It became the first region to create a really clear, defined process with specific steps and roles. They even put a deadline on it, a maximum of 54 days from the initial request to when the process can be completed. Now, it's really important to understand that the rules for who is eligible are incredibly strict. They were set by the court, and a person has to meet all of these conditions at the same time. This ensures the decision is only made by someone facing a very specific and severe set of circumstances who is fully capable of making their own choice. So what Tuscany has done really throws a spotlight on this major tension in Italy, that gap between regional action and national inaction. And it leaves us with a really profound question to think about. When a court says act and a parliament stays silent, who should lead the conversation on life's biggest questions? Should it be the regions?